Well, good morning, everybody, and welcome to the summit. Yay, you made it! We are starting this just a few minutes early. We're not going to get right into the content right away because we wanted to open this window up for if there are any questions or concerns related to the technology itself to allow others to be able to see that. So we're going to leave this open. We will still start at the 10 o'clock hour, so we have about 7 minutes for anybody to toss questions in if there are any questions or concerns with how to use this platform.
The other thing to notice is that when you first log in, there's a live help, and all you have to do is click that, and it will carry you into a Zoom session with a live person to be able to walk you through. Her name is Shireen, and she's joining us from the West Coast this morning to coach us through any bumps we run into today. So just feel free to jump in the live help to get us along the way today. We're glad you're joining us. So, Doug, why don't you throw a question out there to everyone over on the banners to see if we can get some information from those that have joined us early.
All right, so I just tossed a banner out, and if you could just toss in the chat, where are you coming from? Where are we hailing from the great old state of North Carolina? Assuming most of you are coming from North Carolina. Apologies if you're not from North Carolina, but I'd still love to know where you're from.
I thought I'd get us started and make sure everybody knew why I sounded so Eastern North Carolina.
So, Lisa, you actually are bringing up a great point to point out to the audience that there are two different types of comments that you can leave. There are general comments that I believe everybody in the feed is able to see, and then there are private chat comments. And Lisa, I'm not sure if everyone got to see your response. I can see it, but it shows me it's a private chat. So I'm not sure if the rest of our participants can.
Okay, I see the difference between the private. Thank you. That was a good deal. Now we know as we learn the platform.
Evan and Brandy, we're all learning along the way on this platform. It's a different platform than we've used before, so don't worry about it. We're going to figure it out along the way. And again, hop in the help if you get stuck along the way, but I think you'll figure it out. And we've set up announcements, so at 1 minute before a transition, you're going to get an announcement to tell you what to do next. So I think you're going to be okay.
Gail, may I toss another question in the chat?
Absolutely.
All right, I'm going to toss one more while we give ourselves a little waiting time. So, for the professionals in the room, who do you work for?
How do you put into the chat, Doug? I can't figure it out.
That's a great question, and I'm sure somebody has the answer to that. Unfortunately, I am not that person.
Okay.
So if you'll go to comments rather than private chat.
Yeah, and I'm in there, and as long as everybody else knows what to do, we're okay.
Yes.
Yeah, I'm seeing on my moderator side that it's not letting me leave a general chat, but it'll let me private chat.
Yeah. Yeah. So make sure you put your comments in there. Now, if you and the comments go across everything, so everyone gets to see them. There's Joe Rutledge joining us today. Surely she's not the only professional in there.
You got Joe. I see Joe Allen and Joe Rutledge. You got
yes.
Going to give ourselves just another moment here. And then we will be at the 10 o'clock hour, and I'm going to lead us into our first opening. Good morning, Rochelle Johnson. Met you a couple of years ago at Ponysaurus for one of those fostering family events.
And Rochelle, I sent you an email. I want to connect.
All righty. Well, everyone, we are here at the 10 o'clock hour. So I'm going to go ahead and lead us into the start of our day. So again, if you're just joining us, welcome to the Fostering Families Summit Fostering Family Alliance Summit. Really mixing up my words there. It is kind of a mouthful, and it is 10 o'clock on a Saturday. But good morning. Hopefully everybody brought their cup of joe with them and is ready to get started with the exciting event that we have planned for today and all the exciting speakers that we have lined up. This is going to be a great and fantastic day. I'm going to go ahead and jump us right over to our welcome in the state of the state. And I want to introduce to everybody our two speakers for this opening session. We have Lisa Colley, who is the Senior Deputy Director of DSS, Child Welfare, and Adult Services. And we also have Gail Osborne, who is the board chair for the Fostering Family Alliance. And I'm going to go ahead and turn it over to both of you guys, and you all can take it away.
So I'm going to start first. I'm Gail Osborne, I am a foster mom. My husband is the foster dad, obviously, but we have been fostering for about 12 years. We've had approximately 25 to 30 kids. Every time I sit down to figure it out, I forget a kid here and there. And so finally, I'm just like, we've had a lot over the years. We ended up adopting two kiddos who are now 14 and 11, and now have a long-term 3-year-old heading towards adoption. And so, my background is in advocacy and, changing policies and making them better and things like that. And so it just all fell in place that, what better place to run the two passions of my life of fostering and advocacy together than to, align with FFA. And so you guys get to hear from me a lot. And so I really want to turn it over to Lisa and really hear from her. You guys don't get a lot of time with her, and I can reach out to her and during the months and years that we've been together, but I want you to hear from her and how things are going in the state and what policy is doing and how we're working together to really make a change for foster parents and foster kids in North Carolina.
Thank you, Gail. And I think I really appreciate that introduction. The reason I'm in this position is because, like you, I have a lot of experience in the child welfare system and a lot of care in that system, and don't have a lot of complacency. and willing to just work with, our staff here and groups like the Foster Family Association so that the right changes are made. So I'm going to give you, if you want to go to the next slide, I'm going to go ahead and talk and just dive in. I love the title of the summit, putting the pieces together, because that's really what we have to do. When you look at taking care of a system, of a child welfare system, you have to have all your pieces to make a whole. So I really want to talk about
Hang on, Lisa. I'm trying to figure it out.
I think there's a lot of change that's going on in North Carolina right now, and I want to try to put those pieces together for you as a foster parent association, an alliance, and also for you individually as a foster parent. And I'm going to put it together in the context of children, because I think that's how we all understand it, and that's how you came to be a foster parent, was that need to serve children. And so if you think about what is the time in North Carolina? Where are we? We're really at a place where we have decided to improve our child welfare system, and there's 4 tenets that really are guiding this. You want me to try?
Yeah, that'd be great. Okay. I cannot even get it to move. I'm sorry.
That's all right. Well, you want to stop sharing and let me see if I can do it, y'all. This is a really cool platform interactively. I am not your best sharer though. So, okay.
Wait a minute.
Let me get it up. See what I can do here. Can you see it?
Yes.
Wonderful.
So going to.
Right. We're good. And I can move it too. That's even better. All right. So here is where we are. Now is the time in North Carolina. If you really want to change your services to children and families and make an impact, you got to decide what it is you want to change. And so we have 4 tenets that guide where we're going. And I'll talk about the drivers for what's causing us, what are we doing to cause, that makes us want to change. There are things you see, and I want to have full transparency around from just a state perspective. What's the big picture too? So now when we look at what do we want to change, we want children to be supported so that they never come to the attention of the child welfare system in the first place. CPS never darkens the door, and there are things you can do to impact that. That's big system change. But when they are reported to Child Protective Services, there are ways to assist families so that children can remain safely at home. And I use the word safely at home because if children can't remain safely at home, then they have to enter foster care. And what we want there is to make sure that if they do, they are placed with kin or in family settings. And if reunification is the plan, that they reunify quickly to safe homes, not just quickly, but quickly to safe homes. And if they can't be reunified, that they achieve permanency with a family as soon as possible. Okay. So what's driving these changes? What are the things that really make us want to go there? What do we need to do? Probably you remember Ryland's Law around 2000, the end of 2016, the Social Services and Child Welfare Accountability Act, which spelled out changes that North Carolina need to make locally. That was the North Carolina law. And then there's the Federal Family First Prevention Services Act. And I'm going to go through the 2 of those just very high level so you understand what's in there. And it will help you understand some of the changes that are to come. And I think it gives you some hope for what you expect to see. And then the next is the focus on outcomes for children and families. If you think about, North Carolina had a federal review, and that federal review is out about cases. The feds require the state to look at a certain number of cases, and the outcomes are real. Did children, were their health needs met? Were their Did they maintain contact with their parents? Were their services provided to you as foster parents or to kinship care? Did it really happen? And that focus on outcomes, and the fact that North Carolina was not in substantial conformity with a lot of the outcomes in that review is another part of what's driving us to change. So how is it all going to happen? And I'm going to go through a little bit each of those 3 slides, because these are the things that are relevant to you as foster parents that you need to understand as a child welfare system. So in response to Rollins Law, there was so much there, but there's 2 big buckets. I think that as you plan as a foster family alliance, as you serve as foster parents, here are some things that you will see in the next couple of years. You will see a child welfare practice model. And what a practice model does is it creates consistency by defining expectations of leaders and staff. So it has essential functions that all workers are expected to do that guide how they communicate with you. And so when you do that with 100 counties, you have to get engagement. And so we have spent significant time with our counties, and we have teams of stakeholders called design teams, and I think some of you may be on those design teams, really looking at what are the expectations of leaders and staff across the state. And so when you determine what your consistent expectations are in your practice model, then you have to determine what skills support those expectations. And so North Carolina will implement a practice model called Safety Organized Practice, and it has skills that help staff, leaders, provide better services to families, including foster families. And I'll give you a couple of examples. One is a part of our practice model will be the use of harm and danger statements. And so right now, when you talk about does a child return home, the language is very different across the state. But in the practice model, you think about it this way: the harm is what happened to a child because they were abused or neglected. They were left alone, they were hit, they were hurt. That's the harm. The danger is what remains because the parent's behavior needs to change. And it teaches social workers, attorneys, foster parents how to have the same frame. I think if you think about, have you ever asked, what does it mean? What has to change for this child to go home? And sometimes the answer is not as clear. This will give us clarity around answering those questions and make it better, you as foster parents better able to understand that. Okay, the regional support model. I know you've heard 100 counties, 100 different ways. The regional support model breaks the state into 7 specific regions. It will still be 100 county departments of social services, but they will be joined in 7 regions. And services to departments of social services will be delivered in 7 regions. And it really allows more technical assistance to counties and continuous quality improvement, and also provides the opportunity for regional service delivery. So in the future, when North Carolina contracts, when the state contracts for support services, we won't pilot things and try to make it work. We will use the 7 regions to have statewide services. And I'll give you an example. We do intensive family preservation for families that are at risk of their children entering foster care. And it's there, and we have contracts, but they're not geographically specific to certain counties. And it doesn't allow the counties to really know the agencies. In the future, there will be 7 regions. And so if you think about it, if your foster family alliance wants to grow, then you will need to really think about a good model would be to align with those 7 regions, because those counties in that region will come together for many different things. When we roll out a service that foster parents may be interested in, like Triple P, it will be there will be an agency that serves a region. Right? They could serve more than one region, but it breaks the state up into 7, which is much more manageable way of delivering services than it is trying to have 100 county departments of social services. Okay, let me see. All right, so then there's the Family First Prevention Services Act, and you've probably heard a lot about that, but I want to cut it cut to the chase and just kind of tell you what it is that I think matters to you. The intent of FFPSA is really to, the intent of FFPSA is to make sure that we focus on prevention, and what it does is it moves the funding for congregate care, for placing children in congregate care. It moves that funding to the beginning of services and allows you to purchase evidence-based services that prevent children from entering foster care. And so what it seeks to do is to safely keep children in their own homes and prevent them from entering foster care. There's a lot of rules and regs around it. It's only the services that are approved by the Administrative Office of Children and Families, which is our federal agency that has oversight of North Carolina and all of the states. And the other thing it does is it seeks to reduce states' reliance on group care and residential treatment and instead prioritize kinship care and foster care. And then it provides federal funding for some qualified residential treatment programs that provide specific services to children that need residential treatment. And so when you think about these three things, I want to talk to you a little bit about who's not in kinship care and foster care in North Carolina. And I think that when you look at, we've taken a lot of look at, so it will reduce the amount of revenue North Carolina pulls down from the federal government to pay for group care. And so we think we need, so we looked at who's there. And what we found was there are a lot of children that are there because there are not foster homes to take them. And y'all know who they are. They are not babies. They are teens. And some are as young. There are some young children there, but for the most part, it's teens because we lack foster families who will take teens. And so I think as we grow and look at who needs to be recruited in the state, we don't lack for people to take babies. We don't lack for people to take younger elementary school age children, but we lack for people that will take, fifth grade on up. And so that is when you look at where we're going as a state with recruitment, we will always pull in people that want the younger children, but you have to work to get the people who want to parent teens. Now, I am not your person to really work with babies. Most of my, and I like babies and have children, but most of my experience is teens. And so it's a special place in my heart where we're going to have more foster parents for those children, and also really to have more kinship care placements and to have our kinship care families licensed. It was really nice to see on your agenda Joe Allen's presentation about kinship care because that's so important. Okay, so the focus on the outcomes, really thinking about what do we want for children, and that there's a lot of emphasis on the tool that looks at it, that you use when you do our federal review. And like I said, it focuses on real outcomes. And so it looks at were cases were in Child Protective Services, was there integrity in your CPS? Did you see kids on time? Did you do good interviews? Did you engage parents in safety planning? But what I really think is important for y'all to know is in the permanency realm, it really looks at, was the plan appropriate? And so there's focus on, is this the right plan from a qualitative approach? Was this a right plan for this child? And so as we look at our case reviews, we're finding the things that you're telling us. We're hearing what you're saying about guardianship is not always the right plan. And those things are showing up in the outcomes. Well-being, do children actually, are their health needs met? Do they go to the dentist? All of the things that have to happen so that children are healthy and well and do well in score in that well-being category. And so we're really focusing as we transform our system on looking at real outcomes. I will say we have focused a lot more with our staff, and we have focused more on safety just because that's where you have to start and are moving into permanency. Okay, so for you as foster parents, as you put the pieces together, because I've talked through what will be, 5 years of transformative change. There's a strategic plan. There's a lot of work to be done. How do you put the puzzle pieces together? What does this mean for you? And so what I want you to hear is, going forward, And this is in the governor's budget. So I will say that number one, some of it depends on the governor's budget and positions that are in there. But I will caveat that by saying we have recently added staff to our licensing and regulatory division that Section Chief Linda Waite leads, and added a policy position to really address policy around foster parenting. And also a Angelina Spencer, who really functions in a recruitment space. And I think I come out of large county work. And to think about, my large county had policy people, had a lot of supports for foster parenting, and the state of North Carolina really had to redeploy positions to get to build this infrastructure to support foster parents. So we're doing that with those 2 new positions, and with moving to a leadership role for Linda Way. The other thing to think about, who has functioned remarkably in the regulatory and getting families licensed, but now she has a whole purview of not just the regulatory and the licensing, but also the recruitment and retention of foster parents. And so, but the other thing I want to really say is, in the governor's budget are positions for child welfare, and they are county-facing positions of people who will do technical assistance with counties, and who will focus specifically on foster care, adoption, and foster home licensing. Right now, we have one person who has about from 5 to 10 counties, who's state staff, who goes out and provides technical assistance for all of child welfare, and that's from intake to adoption. And their scope is too big. And I think that's been recognized, and that's the reason this is in the governor's budget. And if we are successful in getting these positions, you will see more change, and you will see more focus on permanency. But I also want to say, even without the positions, there's a recognition of the value of foster parents and the need to focus on that specifically. Okay. You're going to see some enhancements to foster parent pre-service training. There's some real good discussions that are going on around, is MAP the right that we need? Is there a better program? But I will caution you to say, we are going state. We want state models. So we're not real interested in one group doing this and one group doing that. It's got to be consistency, because we want that consistent practice across the state. I don't think I'm a great social worker, but I was a better social worker because I knew MAP. And so when things didn't go like they were supposed to, with foster parents, I could drop back to how they were trained and have better conversations, because I knew their training and I knew their frame of reference. So whatever we decide we are going to do to train foster parents, the workers who come to your house to talk to you about the children, or who do case management with the children, they have to know the model. So there will be consistency across the state. Increased available resources for children. North Carolina is no longer piloting small things. We are scaling what we need for statewide services. And then I've already talked about the additional need for foster parents and kinship care. And then a real focus on the needs of transition age youth. We hope to move, we provide foster care 18 to 21, and a lot of those young people don't live in foster homes after they're 18. But there's a real need to make sure that, for one, you stay stable and don't let any more children emancipate out of foster care without a permanent home. But for those that do, that you provide really good transition out. And North Carolina does that, and has a lot of young people that graduate from high school and go to college. And we want to capitalize on those strengths and really build services in those systems. So good things for your young people. If you are a foster parent of teens, we've made guardianship consistent, 18 to 21 for guardianship. We made that legal change last year. If you took guardianship of a teen, they can still get services up to 21. Same for adopted children. And we're really looking at what can we do as we transform the system to make sure that the needs of those children are met. Okay, now I want to go to pending legislation. Now, this is not law, but these are two things I think you need to follow. Now, when I talked to Gail, she said, all about the Foster Parent Bill of Rights, and I bet you do because there's some good stuff in there. But I want to talk to you about 3 things that I think the Foster Parent Bill of Rights can support changes in, that already, as this is going through the General Assembly, we're thinking about what are we going to do with this. Okay, so one thing the Bill of Rights does is it clarifies expectations of the agencies and foster parents. It puts on paper what the expectations are. Now, some of the things that are in that bill are already law, but the way it organizes it, it makes it easy to say, here's what you do to support foster parents. Here's what they have a right to. Here's how they are included. And it affirms your seat at the table. You had a seat at the table, but sometimes that doesn't happen. And this bill really says who you are in relation to the child and speaks to how important you are in that team that serves the child. But this is my 3rd one. Gail, I had a discussion with Gail as we were talking about the Foster Parent Bill of Rights. And one of the things that just was so exciting is this can shape how you train foster care workers, because you interface with not only the worker that helps you with the license and provides support, but you interface with a foster care worker. And so it helps that worker understand how to work with foster parents and what are the expectations. And so already we think about, if this becomes law, and I certainly hope we get it to the finish line, what it will do to shape that training and how it will change North Carolina and how we interact with foster parents. And the other bill I would say to really follow, it's Senate Bill 693, and we call it the Child Welfare Omnibus Bill. And what's in that bill is language to expedite permanency planning hearings. The problem with children staying too long in foster care isn't just that they stay too long. It's if you go back upstream, it's doing better permanency planning at the beginning of the case, really working reunification initially hard and making sure that parents get what they need so that you can move forward if they're not going to reunify towards termination of parental rights or whatever is needed. And so it has some safeguards in place so that things happen at the beginning of cases. And then the other thing is it adds a training that addresses the roles and obligations of foster parents in judicial proceedings. And it says at a minimum of. And this is what I will call administrative training. Sometimes when I think we will get at the division complaints from foster parents, and when I look at it, I see a lack of clarity of their role. And I think this will help figure out what is the foster parent's role, clearly a role that they have, and can make you as foster parents go into meetings about advocacy, really understanding that role and how to use it. And as well as making sure that you get information you need to parent the child in your home. And then the last thing is it allows any person to file a termination of parental rights petition for a child who has resided with them for a continuous period of 18 months or more preceding the filing of the petition. So if a child has lived in the home with anyone 18 months or more, then that person or the preceding month can file a petition for termination of parental rights. The grounds don't change, so if the grounds aren't there, but it does mean that who can file a termination of parental rights petition? An individual could already, but the timeframes were more than 18 months. A guardian ad litem can, but typically it's the Department of Social Services that files. So that's a part. These are a part of those bills. Now, before I really look at, before I close, I just want to take you here and think about this. I have told you the truth about who my favorite group to work with. It is teens, and I spent a lot of time working with teens in the local chapter of Ffpsa when I worked in the county, and they did and still do a lot of advocacy. But I think that one of the things that was so hard was they wanted things to change now. They wanted it all to change, and it was hard. It was hard to get to help decide, you're going to put some time into this, but it won't change. It's not going to change immediately. And so one of the teens there said, oh, I get it. We're doing this to pay it forward. And we're doing this so that it will change. We're investing. And so I want you to think about that mentality. And so when I probably have, I am not a complacent person. Everything doesn't happen as fast as I want. And so when I think about how hard it is to look at system change and strategic change and all the change that has to happen to improve the system that serves our children, I go back to, if young people understand that and can live with that experience the system, it is how I manage that whole process of it can't happen fast enough. So I want you to think about, here's where we're going. I hope that I've given you a vision of something better, a place where we're going to move to. And I hope that it spurs thoughts and other ideas about where else we need to go. Because what I didn't put in here is just how important it is that we move together with you. And there really is, we really rely on 3 groups to make decisions and to hear your voice. And some of the things that we have been successful in getting in the governor's budget, and there are things that we ask for that are in the governor's recommended budget for the American Rescue Act. Some of the reasons we've been successful is we have 3 groups that give us information. We have the Foster Family Alliance, that's you. We have SAYSO, and we have the Child Welfare Family Advisory Council. And so sometimes you're giving us information because we are the agency charged with leading the state. You're giving us information, and it may not seem like it goes anywhere, but we're waiting for that right opportunity to have change. We're waiting for that opportunity to push it forward, and we always need to know what's going on from your perspective. What are you dealing with? And your agency, the Foster Family Alliance, does a great job of bringing that information to us and are essential in any of the transformative change that happens. And it's not just in giving us information, it's how to make it real and what do we need to do to make it work. So I thank you for that. I want to close with a couple of thank yous, because I appreciate the putting the puzzle pieces together every day. And it's Foster Parenting Month. And so I want to thank you for and just draw attention to some of the puzzle pieces you every day put together as foster parents. And so thank you for the puzzle pieces. And I'm gonna go through a number of them. Thank you for shared parenting. It's the puzzle that doesn't just include the child's parent, but also, because you don't just share parenting with the child's parent, you share it with the judge, with the guardian ad litem, with DSS, and with the staff. That is true shared parenting. And I think we'll have some clarity about that in the future too. Thank you for and puzzles are pieces. So thank you for the piece of courage you have to find and provide a home for a child you don't know. And that combination of the puzzle of strengths, you didn't even know you had to do that. Thank you for the puzzle that is the schoolwork you had to relearn so that homework gets completed. And thank you for figuring out the puzzle of how to complete and do all that is needed to be licensed and stay licensed. We recognize that is an investment and a part of your commitment to being a foster parent. Thank you for the puzzle you put together as you figure out what a child needs or is asking for. And this includes the little ones that don't talk, and the young adults who don't know how to say it. And thank you for putting together the puzzle of the stories of children who have experienced trauma and determining what will make them heal. And thank you for that big picture puzzle of the fullness of knowing that because children live with you 24/7, you see the whole child and not just the pieces that others see. And so thank you for putting together the right pieces of advocacy and diplomacy to make sure a child's story and needs are met, even to the people that don't see the whole child 24/7 like you do. And thank you for dealing with the missing puzzle piece you have to replace in your heart when loving a child means letting them go. And thank you for the puzzle that is your schedule as you put it together and figure out how to get it all done, for rearranging your home and your family to comply with licensing and safety regulations, and how you add the child's family to complete the puzzle of people that are committed to seeing that child grow and develop. That is truly a beautiful puzzle when you do that, because when you add their family to the big puzzle, that child knows that you value not only them, but the people that they come from. And so lastly, I want to thank the board of the Foster Family Alliance for putting all the pieces together during COVID, to create an informative day filled with relevant information that will help you as foster parents. And what they've done, I'm so appreciative of, for building an agency that supports foster parents. And so in closing, just a real heartfelt thank you for all the pieces you put together that make a child whole. And happy Foster Care Month, and thank you for the most important puzzle piece you provide to children in the foster care system: love and acceptance, and a place to go grow and heal. So enjoy your day and know that you are truly valued and appreciated. As we put together this big puzzle piece of a better child welfare system, you are an essential piece of that, and we are listening to your feedback and taking action. So thanks, and have a great day.
Lisa Colley, thank you so much for that and that presentation. And in the interest of time, I'm going to go ahead and end us out here and invite you all to go on into your 10:30 session. We are going to be starting 5 minutes late, but go ahead and hop on in, and hope you enjoy the rest of your day. We shall see you around.